feel like I need to sit up straight near you.
You know, a lot of people actually make that joke.
I never stretch.
Well, you probably should anyway. Maybe you don't have to. Maybe you're the exception. She's the exception, not the rule. Once again, push it all out. All of it. Good stuff.
I love getting my back cracked.
Hey, we love cracking backs.
Oh my god, yeah.
If you do not know that I'm about to pop it.
Nice.
See? Makayla, good to meet you officially.
Adam, nice to meet you.
So Makayla was referred in by her friend Ryle, or I guess client Ryle, who's been on this channel previously. So very thankful for her. Hi Ryle, thanks. I know you're definitely watching this. But Makayla's seen a chiropractor before. She's a former competitive bodybuilder, so she's kind of the ideal target market of myself. So it's really nice having her in here. But Makayla, do you care to walk us through a little bit of your history in terms of like, have you seen a chiro before? Like what it was like being a bodybuilder, the stress that puts on your body, all that good stuff?
Yeah, so I wasn't like a regular person going to physio, chiro, massage until doing bodybuilding because of the demands that it was putting on my body. It was like training with so much intensity and really not focusing on like any type of recovery. Like I wasn't stretching, I wasn't foam rolling. I was just like, let me get a pump and get out of here. Like I'm tired.
Hey, I get that. So, I do get that intimately.
Yeah, so I would go and pay someone to stretch out my muscles for me and roll me out or whatever. I focused a lot on massage therapy.
Okay.
And like here and there I would do chiro, but I really focused on massage a lot.
Was that just because you kind of really liked the massage therapy approach, like muscle work, or like what was the rationale there?
I think it was relaxing, but also I was just so tight all the time from not stretching and training the way I was. So that felt good.
Did you find that it helped you sufficiently?
Yes, but I think more would have been better. Like more attention to...
More is almost always better. So,
like maybe seeing a physio and a chiro. At one point, I had some weird pain in my knee, like post-competing.
Yeah.
And I didn't realize this, but a chiro fixed my problem. I thought I would have to see like an osteopath or like a massage therapist, but...
Did they ever tell you what the problem was with the knee?
I don't
It's
remember.
okay if you don't remember.
Yeah, I don't remember.
Once things get better, we forget about them, right? We can't possibly remember.
Yeah, things are amazing now. It's
okay,
like
good.
nothing ever
Happy to hear.
happened.
Happy to hear. Very happy to hear.
Good.
Yeah.
But yeah, that's the reason I went to chiro the first, actually maybe the most recent time, and then prior to that, I just did like regular adjustments, very spaced out though.
Yeah.
Because I went to school for kin, and I knew in my background like regular chiro or physio is generally good, right? But I didn't really like look deeper into it or know why. But I just knew that it was good for me, so why not do it?
Absolutely. I tell pretty much every single one of my patients that seeing any form of manual practitioner, okay, that means chiro, it also means massage, it also means physio, osteo, whatever. Obviously that's beneficial for you, okay? The people who do that regularly and who pay attention to that, less frequent rates of injury, and in the event of injury, it's less severe as compared to the people who do not. Obviously the exception is trauma. If you get hit by a sledgehammer, it doesn't matter how many massages you've had. But to that end, like, it still seems like you were being responsible and seeing a massage therapist on a semi-regular basis, which is good.
Yeah.
Okay, really good.
Yeah.
The only caveat I put there is that whatever practitioner you do see, I would really encourage you to make sure that they work on all structures. So to that end, like massage therapists, typically it's just muscle, but hopefully we're also doing fascial work. Hopefully they might have been doing some manipulation to move the joints as well, because we're never just one structure, especially when you're putting your entire body under a lot of stress. We're also putting all those other structures under stress. So, you know,
and
hybrid
everything
approach.
works together.
We're
right?
holistic.
So,
yeah, you would fully understand this. You absolutely would. Yeah. Awesome. So you saw the chiropractor before. You've been adjusted or cracked before, head, neck, back, all of that. Perfect. Okay. Out of curiosity, did they do anything with the knee that you can recall, or?
I think he put, like, it wasn't a TENS machine. Oh, it was like some laser thing.
Oh, so you used laser therapy. Okay.
I don't know. Yeah. I remember seeing that and being like, are you kidding me? Like, that seems fake.
Yeah.
It worked.
So ultraviolet laser therapy is something, or cold laser therapy as some people refer to it. Yeah. it's actually pretty good at what it does if you can get over the fact that it doesn't feel like it's doing anything. To that end, because so it's cold laser. People think laser is going to burn you, but you actually don't feel it at all. I've had it done on me to good effect. I had a roommate who I lived with when I was doing school, hi Evan, who had laser done with his shoulder. Now he swears by it because he can play volleyball again, but it doesn't feel like anything. So if you ever do get laser therapy and you're feeling nothing, good, that means it's working. If you're feeling a burn, that means that get ready for a lawsuit, because that's not supposed to happen at all.
Yeah, I'm glad that didn't happen.
Yeah, no, knock on wood. I hope that doesn't happen to any of you guys watching either. Okay, so you're familiar with chiro. You got the massages before. Any kind of fascial work done? You're aware of what fascia is? As a kid major? If you don't remember, that's okay.
But from my understanding, I thought the fascial work was just like the scraping.
Yeah. So that's what I do a lot of on this channel. So just making sure you're aware of kind of the things that at least like I'm familiar with at least, right? Good. Okay, so that pretty much covers Makayla's background there. So what we're gonna do next is we're gonna get into a physical examination. Sorry guys, apparently I can't speak properly. So we'll get into the physical examination, and then we'll follow it up with some treatment methods. How does that sound?
Cool.
Perfect.
I'm excited.
Good. I hope so. So am I. So are they.
I feel like I need to sit up straight near you.
A lot of people actually make that joke, and by all means, I see myself sitting on there, and I have the worst posture. I have to respect myself. So.
I forget sometimes.
But I'm happy to be a constant reminder of health and posture and all that. All right, so let's do a neck range of motion. I'll get you to start just by rotating your head as far as you can to the right. We can get to about 85 degrees. Really good. Rotate as far as you can to the left, please. Another 85. Very good once again.
Nice.
I'll get you to bring your right ear down to your right shoulder for me, please. Good. We get to about 45. Left to left, please. And is there a little bit of trouble in that way or no? I'm imagining that, aren't I?
Does it look... Well, I definitely feel a stretch.
You feel a stretch. Okay.
Yeah.
So we're 45 again. Bring your chin down to your chest for me. Does that cause any discomfort back here at all for you? No? Okay, look up towards the ceiling.
What?
Yep. Any discomfort or pinching back here? Any history of headaches at all?
I used to get migraines a lot.
You used to get migraines. How long ago was that?
Oh, like years ago. Like probably
ago.
like 5 or more years ago.
How did you get that resolved?
My doctor told me to start taking a certain birth control, which I did.
And has that been helping you?
Yeah, but I actually went off it recently.
Okay,
and I
still
haven't
no
had
migraines.
No migraines.
Once again, we're going to knock on wood for that.
Yeah.
Feeling through Makayla's traps.
That hurts.
I was going to say, did you do pull day or upper back day recently?
No, I actually haven't trained in so long because I've been dealing with something.
Okay, fair.
Yeah.
You know what? We can talk about that off camera, I feel like, otherwise.
No.
But feeling through the traps here.
But I have been stressed. So maybe it's like...
Because a lot of people do carry their stress up in the traps. Like, that's very, very classic.
Yeah.
A lot of tension up here, okay? So that is good. I'm very impressed to see that the range of motion of the neck persists while simultaneously having this amount of hypertonicity in this region. But it's not unheard of, clearly, because Makayla's doing something right. So you might be stressed, you might be dealing with something, you're doing something right still.
Okay, cool.
Small victories. Get you to give yourself a tight hug. Probably earned it. I'm going to get you to rotate as far as you can to the right, please. Good. And I'm just going to get you... sorry, keep going. So that's about 45 degrees. Now rotate as far as you can to the left. That's about 45 degrees again. Good. All right, get you to stand up for me. Please try to bend down, touch your toes for me. Let me know what that provokes.
Straight?
Yep.
Knees?
Keep the knees straight. Does that provoke any lower back? Okay, she's got her palms on the floor. Any lower back discomforts with that?
No.
No, come back up the other way. And I get you to extend backwards the other way, please. And you just come, just like that. Anything in the lower back there. You are very mobile. Do you do like yoga or something? Yeah,
No.
I'm very impressed. Really?
I think I'm very not mobile.
Okay, you can have a seat. Your standards are way too high. You can relax those too. Because like seriously, she had her hands flat on the floor. She can hyperextend backwards. I'm very, very impressed with what I'm seeing right now.
I never stretch.
Well, you probably should anyways. But still, regardless, maybe you don't have to. Maybe you're the exception. She's the exception, not the rule.
I actually have a question.
I have an answer.
I heard hypermobile people aren't supposed to stretch. Well, not as much.
Well, okay, so that's a good point. So there's a difference between being anecdotally hypermobile and clinically hypermobile. Okay, clinically hypermobile people known as Ehlers-Danlos syndrome. I think that's how you pronounce it. I might be saying that wrong. Have you heard that before?
No.
No. Okay. So I can screen you for that later, but I don't think you're actually. You know what? Let's go ahead and do it. I get you to straighten your arms for me and go as far as you can. Can you hyperextend them?
Oh.
Can you bend the elbows backwards? Essentially?
Well, I don't think so.
A little bit. Okay, can you bring the thumb down to your... can you bring that down all the way? Are you able to?
Can I, like, this way? Or this way?
Either way.
This way, maybe. No.
A little bit, maybe. But not quite. Okay, you might be borderline. All right, but to say that you're clinically hypermobile, I wouldn't go quite that far.
Yeah, like my knees don't
Your knees don't hyperextend. That's a third one there that you got to do there. So you stand up. No, they don't hyperextend. So I would say that you're not meeting the criteria for that. So I think that stretching would be fine in your case.
Cool.
Maintain the mobility, right?
Yeah.
So Makayla is an interesting patient because when we did the range of motion examination, she is solid pretty much everywhere, much to her own surprise because she thought she was quite limited. However, when we actually felt through the muscles around, there's quite a bit of hypertonicity. Now, why do we get those kind of muscle knots, those muscle strains? We don't actually know the answer to that, so if anybody can figure that out scientifically, please mention it down in the comments because that's exciting. We do know that things like stress, overwork, fatigue can all play a role, but as for there being a causative agent, uncertain. That being said, that's why it's important to put your hands on the patient to actually feel through structures to see how they are feeling when we're talking about musculoskeletal health. So, I digress. Let's get into it. Bottom of the spine exists our sacrum. The sacrum connects into the ilium or our hip bones proper. So the sacroiliac joint right there and right here. So the left side feels a little bit tight to me, but that's okay. We'll climb on up. Now you said you actually get left side lower back discomforts when you sit for too long, yes?
Yeah.
Perfect, okay. Well, not perfect. I'm very sorry you're dealing with that, but that kind of makes sense there. Climbing up the back into the T-spine now. Hope you're not ticklish. You feel pretty good, but there's a little bit in there. I'm going to get you to take a big breath in for me, please. And then all the way out, please. Push it all out. Good. You're good. Good stuff. And in. And all the way out. Once again, push it all out. All of it. Good stuff. Okay. There's quite a bit in the first one there. I take it you probably felt that?
Yeah, I felt that. The sound was satisfying. I love getting my back cracked.
Hey, we love cracking backs, so I'm happy you're here. You're in the right place. Might be a little one. There, good. Ooh, that was a strange one. Yeah, it went, but that was weird. Okay, that's okay. No, left lower back. So what we're doing here is something called an iliomammillary mob. In our lumbar spine, we have quite large vertebrae, and they have a little mound on them that are referred to as the mammillary process. Why are they named that? I really don't know. Oh, that's me, guys. That's not you. I just got an email. But we're essentially contacting that process and trying to almost stretch out the low back in a way that isn't commonly stretched out ourselves. So. Sounds like the gym is starting up again.
Oh, cool. There's a gym here.
Yes, I can show it to you after.
Cool.
We will get your low back next. I'm going to get you laying on your right shoulder, left side up, okay? Now, Makayla's in a good position here, but we're just going to make sure she's in the right one. So I'm going to take this, I'm going to hold there, you're going to put that elbow right there, perfect. I'm going to bring this hip upwards, and we're going to scoot your hips closer to the edge here. Good. So have you've had your low back done before like this? Similar position? Yeah. Sideways? Okay, good. I'm going to roll you towards me. Mm-hmm. I promise you're not going to fall off. Okay, so you just stay as relaxed as you can. I'm going to move this over here. Good. And good. Oh, nice.
Oh my god, yeah. That was good. Did you guys
That's a great reaction. Yeah, I think they heard that one. And hips a little closer. Thank you. I'm going to take this. All right, and we're good. Perfect. Well done, Makayla.
Thank you.
We will get you on your back for your neck next. Okay. All right, I'm just going to come on in here, and you can just try to relax as best you can. Now, Makayla has mentioned that this makes her a little bit anxious. Is that true?
A little nervous.
All right, well, I promise you, I've done this before like 10 times. Okay, so I definitely have a good grip on it at this point, I
twice.
think. Definitely more than twice, less than 4. So, yeah. When was the last time you got your neck adjusted, if you can recall?
Oh, that's sore.
That right there at the top?
Yeah.
So
Maybe like a couple years ago.
A few years ago. So I'm pressing right now into Makayla's, you guys can see my finger there, suboccipital region. I'm basically finding the base of her skull, which is right here, sliding down like less than an inch and pressing in right there. Responsible for a lot of a rotational aspect, but in adjusting, I need 2 things from you to make sure that this goes okay. The first is for you to rotate as far as you can to that right side, and the second is for you to not know that I'm about to pop it.
Nice.
See? Very simple. Was that at all that scary?
No, not at all.
Good.
I just usually have to focus really hard to relax my neck.
Well, were
But
you
the fact
focusing
that
really
I
hard?
didn't realize it was happening.
There we
was- I
go.
was
See, that's the
relaxed.
trick. Bad news, you have 2 sides and that trick only works once, right?
Yeah.
So, all right, well, we'll work the other side and we'll try that. That was a very specific adjustment to the suboccipitals. I wonder if there's more lower down. I don't think so, but we'll revisit the right side in a moment.
That side's sore too.
Yeah, that's lower down for sure. Now, I'm turning to the right, and you're just going to drop into the hand. Perfect. Good. See, not scary at all.
Not scary. I'm always so relieved the second it happens, and I'm still like
It's
alive.
done, thank you. Hey! It's done!
It's
Yeah.
just so scary.
You're okay. Okay, so that's still a little tense. Let's see if there's anything on this right side lower down. Just drop. No, okay. I was making that up. You did it. You did great.
Yay.
See? Nothing to be afraid of.
Nothing.
So a staple on this channel, as y'all are probably familiar with by now, is going to be our instrument-assisted soft tissue therapy. I love this stuff because it works both the muscle as well as the fascia at the same time. Sorry, that's a little bit cold. I swear I keep it room temperature, but it doesn't heat up for whatever reason.
It's all good.
So that's what we're going to apply here. We need to use some form of lubricant because otherwise this would be very, very painful. All right, so Makayla, usually around this time is when I try to encourage the patient to share a little bit more about themselves. That way, again, authenticity is a big thing on this channel for me, and it gives the chance for an audience to connect with you as a person, because that's who everybody who comes into this, who goes to see a doctor is. They're a person, and they are the priority in these situations. So anyways, a question I want to ask you today, it's pertaining to your job. I guess you're probably going to talk about GFit, which you're welcome to, or whatever it is that you do otherwise. Tell us something about your career that you find rewarding, very, very, like something that gets you up in the morning.
Yeah, for sure. So if I talk down here.
Yeah,
you
the
can hear?
mic's gonna pick it up, no problem.
Okay. Well, actually, wait, hold on. This is ticklish, so I have to
Okay.
answer in like when you're done that area.
This area right here.
Yeah.
What about over here?
Not bad.
Not bad? Okay.
Okay.
I'll avoid that area till you're done
Yeah, till
talking.
I've done my sentence.
Yeah.
I work with a company where I'm able to coach people through whatever goals they have nutritionally and like movement wise. So I get a lot of variety in people's goals. Like some people have aesthetic goals, which are fine and like fun. And a lot of people have wellness goals where they're trying to like decrease the amount of medication they're taking or manage diabetes or
I intimately understand that one. That's a
yeah,
good one.
and like I feel like those are the clients that I really enjoy coaching because I feel like I'm actually making a huge difference in their life and their actual health.
Do you have any like success stories that you're comfortable sharing with that?
Yeah, I have one client right now. She messaged me like, a few weeks ago saying that she doesn't have to take metformin anymore, and she's been on it for like her whole life.
Phenomenal. So what changes did you make with her?
Lots of movement and like easy movement, right? Like walking, and she really loves dancing, so she'll like put on YouTube videos in her family room and like get her movement in that way. And then just trying to go, like there is meal planning involved, but in choosing those together, we collaborate and find things that are going to work for her in her schedule, foods that she likes, but making sure that it's just like balanced whole foods.
Versus the ultra processed crap we're usually used to?
Yeah.
Yeah.
Which is like so widely and readily available. It's like when you start to prioritize whole foods, it's like I find people that think that you're on like a diet.
And you're not. You're just like eating like a normal person.
It's funny that they call the paleo diet a diet when it's really
know.
just like, hey, you're just eating stuff that isn't processed, man. Like
Yeah,
that's
'cause
it's not a diet, it's health. Like
Yeah.
that's I don't know. That's my take at least.
So it's cool when people have like real health goals.
Versus just I want to get shredded. That's always fun.
It is
but
so
it's
fun.
like it's not. That's not necessarily healthy in a way. In fact, I'd actually argue that it's the opposite to do that.
Yeah.
But yeah, and this is somebody with a background in the bodybuilding, so I'm not being prejudiced. I promise.
No,
But
no,
I
love bodybuilding.
That's good. Thanks for sharing that. You're a kin grad, so you've probably heard the expression "movement is medicine." Have you heard of that before?
I have.
You have? Yeah, so true, guys. If you are a sedentary individual, any kind of movement, any kind of intentional movement going to drastically decrease your chances of developing some rather serious complications later on in life, okay? So just take the stairs, sign up for that yoga class, go for a bike ride with your kids or whatever. Just anything is going to be beneficial for you. And I think you'd agree with that.
I totally do.
Good, happy to hear.
I try to encourage my clients to do any type of movement that feels good. Like
Love
if they
that.
want to play tennis with their kids, or it doesn't need to be like cardio and weights all the time.
I could not agree more. Best exercise is whatever a person enjoys, because then they're more likely to do it more often.
Yeah,
right?
for sure,
So,
for sure. And like adherence is key, right? Like
that's why they got to enjoy the process.
Yeah. Even if the plan is like the best possible case scenario, if they're not able to follow it, it's
Not gonna
worthless.
work.
Yeah.
So what do you think of the expression, well, I guess this isn't really an expression, but consistency beats perfection every time, right?
Yeah, for sure. Yeah, you could be consistent with some really basic shit like walking, and like you're gonna see improvements.
You'll probably lose weight. Your heart will probably improve, right?
Yeah.
Even if it's just something super simple. Oh no, you walked 4 kilometers instead of 5. That doesn't matter. You're okay.
Yeah. I feel like there's a lot of people that have like an all or nothing mindset.
Oh God, that is the worst mindset you can maintain. But I completely agree with you. I see it in my own patient base all the time.
Yeah, and I've even been there at some point, like post competition, when I'm used to being like 100% perfect, and then all of a sudden.
Hey, you are 100% perfect.
Thank you.
You're welcome. Compliments are free on this channel.
Thank you. And then going from that to like having to make like other choices, my own choices in terms of food and exercise, and not following a plan as strict.
Yeah.
It's like, whoa, big adjustment.
No pun intended. No, that's another reason why I haven't done like a bodybuilding show myself, is because I feel like if I ever hit that, I'd probably compare myself going forward to where I once was all the time.
Yeah.
And probably like a little bit of body dysmorphia there, right? So like with the all or nothing approach,
really common.
it's not healthy, right? You can really get yourself suckered up and miss out on like 80% of the result if you just kind of abandon that mindset. So I love talking to people about this kind of stuff. So you're really really good patient to have on here. Thank you again.
Thank you.
Ticklish still? Are you okay?
On the top left, like my shoulder blade, yeah.
Really up and through this region, eh?
Yeah.
It's weird to have it so localized.
Like it's still like
Manageable?
yeah.
Good. I bet that's not ticklish.
No, it's not
Good.
too sore either, though.
Good. Also good.
never mind.
Oh, she takes it back. That's okay. Yeah, that right there.
Yeah, that's messed up.
That's not a fun spot. So that right there is going to be Makayla's levator scap insertion. Do you remember what the levator scap is from your kin days?
Oh, I couldn't like name anything now.
That's okay. That's okay. Levator scap connects from the neck down into the top of the shoulder blade area right there. It is a criminally tight muscle on anybody who breathes oxygen, also known as pretty much every person alive.
Oh, wow, that's very tight.
Yeah.
Oh.
Okay, just breathe for me, and if it's too much, again, you just let me know and we'll back off, okay? Good. Okay. Not as bad on this side.
No, it doesn't feel as bad. That's weird.
Yeah. Are you left-handed?
No.
No, that would explain that, but I guess not. Okay, spend a little bit of extra time on this. I can hear you doing the controlled breathing. You're really
trying
suffering
so
through this,
hard.
aren't you? You're doing great.
We didn't know this was so tight.
Well, it's okay. It's my job to come around and poke these things, so. To those people watching, it's very common. We don't even know we have these stiffnesses until somebody pokes you. So if you haven't gotten a massage and you have benefits, go get yourself a freaking massage or see a chiropractor. But, you know, or drive and see me. I'm happy to do that too. I'll do both. Combine the two like I usually do. Good stuff.
Oh my god, that hurts.
Well, bad news. We're not finished with it yet. We're just going to hit it in a different way.
Okay, it'll be better later.
Yes, it will be. Yeah. Very big fan of hurts now, better later.
Mm-hmm.
All right. I'll get you to push your shirt back on. So I wonder if you'll find this ticklish.
No, I have one of those.
How often do you use it?
Never.
Exactly.
I do sometimes. Pre-workout.
One method of warming up, I suppose. Not
Get
ticklish?
the blood going.
Yeah.
No, it's good.
Yeah. Get you sitting up. Alright, we've come full circle. When we first started, we had quite a bit of tension up here. There's still some on the left that I'm feeling. The right is feeling better, but we're going to finish up with some MRT, myofascial release technique. Y'all are really familiar with this at this point. Makayla, I'm going to get you to look up into the left for me, please. Now, with her looking up into the left, I'm going to take my sharpened elbow. I'm going to put it right there, and now I'm going to get you to slowly look down and to the right towards, like, I really have to take my trash can out. Towards my trash can. There we go. Okay.
Should I sit up straighter? Is that gonna affect?
You can come up straighter a bit, sure. And now, again, down and to right.
Oh my god.
Problem is that you're tall and kind of short, so I gotta my toes. No, you're fine. You're fine. I'm just making a joke. Yeah, okay, good. Okay, good. Up to left. And slowly down to right. Good stuff. Ooh.
Oh my god.
That was a guitar string.
That was scary.
Well, I promise you. Well, actually, I can't promise this won't hurt. And now down and to right. Good. And up to left. Down to right. Good stuff. All right, I'll get you to now please face forward for me.
Like.
No, like towards the window. Perfect. And I'll get you to tilt your left ear to your left shoulder. Actually, I'm just going to move your hair a little bit. I don't want to pull your hair here. It's long and wonderful.
Thank you. Yeah, that would hurt.
Tilt. And now we're going to tilt right ear to right shoulder. Go ahead.
Oh my gosh, I can't.
Yes, you can. I believe in you. See? Look at that. You got so far.
Am I supposed to go more?
You can go as far as you can. Left to left. And now slowly right to right. Whoa. That's fun for me. Hope it's fun for you too. Left to left.
It will be.
Yes, it will be.
Later.
Right to right.
Oh my god, did you feel that?
Yes, I did. So what we're feeling, by the way, is Makayla's upper traps sliding underneath my pin, which is my elbow. Doesn't feel great to either of us right now, but it is a muscle knot, and we're going to keep working on it. Are we going to be able to get it today? I don't know. I've already kind of beaten the crap out of it. But in Makayla's case, I'd probably recommend a little bit more frequent appointments off the start just to get that under control.
Yeah.
Then once that's sorted, like every other patient, you can either call the person whenever you need them, or you can go on a proactive wellness plan like we talked about beforehand. If you see a manual practitioner regularly, quality of life improves, resistance to injury improves, all that good stuff. Bad news, two sides. Let's do this side. I'll get you to look up into the right for me, please. Other right. There you go. Crushed it. Now slowly down into the left, please. Good. Up to right. Slowly on the left. Not as bad on this side, eh?
No.
Up to right. On the left. What are you doing with your left arm that you're not doing with your right?
Dude, I don't know.
Beats you, huh? Beats me too.
Yeah, I don't know.
Right, good. Face forward for me. Tilt right ear to right shoulder, please. Good. Now left to left.
Oh, this one's easy.
Yeah, this one's not bad at all.
Piece of cake.
Right. So my homework for you is to figure out how you're loading up this left side and not the right. Okay, maybe you're carrying heavy stuff with the left more. Like if you're carrying, we found a trigger spot.
I carry my tray in my left hand.
Okay, that might be it.
So
but and right to right. How heavy are these trays? I mean, with all the drinks, I suppose they'd be kind of heavy. But
yeah, like 8 or 10
right
cups filled with, liquid.
Right. I don't know. I never. Actually, that's I was a bartender once. But
Ooh.
Right to right. Ooh, ooh. Right to right. Good job, Makayla.
Thank you.
Gonna get you to, last thing, shrug your shoulders up into my hands. Good. Now slowly lower them down.
Oh my god.
Slowly lower. Come on. You got it.
I'm scared.
You okay?
No. Okay, let's do it again.
Consent-wise, you're okay? Yeah, let's do it again. She's fine. She's fine. Okay. Always check. Okay. Now go ahead. Shoulders up. Slowly lower down.
Okay.
Good. And last one, up, up, up. Slowly lower. See, look how calm she looks, guys. She looks like she could be at the spa right now. She's so loosey-goosey.
So loosey-goosey.
I hope so. I'll get you in the chair for the last take. Okay. Makayla just told me that she feels like she needs to go home and have a nap. Unfortunately, she has to work.
Yes.
But how did you find that? How do you feel right now?
Right now, I feel great. I feel loosey-goosey.
Okay.
Right after every crack, it was like instant relief, like my whole body. Yeah, it was like, yeah. Mm-hmm. So generally pretty freaking good. I'm
very happy to hear that. Great example of a person who's obviously a little bit hesitant about the adjusting around the neck area, but still gets like an immediate therapeutic effect. Not everything that you're going to see happens in a chiro office is something you see day to day, so your hesitancy is completely understood, but I'm glad you can see the benefits afterwards because you feel really good, right? At this point in time, I usually open it up for any questions that a patient might have. Do you have any questions for me whatsoever, whether that's about treatment, chiro? Okay, what do you got?
I actually have a question. Is there ever a point where is there ever too much chiro?
Too much chiro.
Like multiple times a week or, I don't know, too much treatment?
So it depends on how you're defining too much chiro. Is there too much chiro to the point of it hurting you? I don't really think so, because there's not really so much thing as too much massage, right? Now, granted, you can definitely beat the crap out of someone therapeutically, like with massage works, and cause bruising and all of that. And I would imagine that there's a point for there too. Is there too much chiro in terms of treatment plans for some injuries that people have presenting to chiro clinics? Absolutely. Okay. I actually created a whole video about this, and I named it Predatory Chiropractors, What to Watch For. A good rule of thumb is that if you're seeing a chiro and they recommend to you a treatment plan of anything more than 3 times a week for 3 to 4 weeks, that's key, 3 to 4 weeks, you're probably getting scammed. All right. So to that end, if anybody ever tries to put you on like a yearly treatment plan or like 60 visits up front, something like that, that's too much chiro for literally any problem you're walking in with. Okay, so I do highly recommend, if you do get told that kind of number, that you seek second opinions from other chiropractors and also other healthcare providers, including your family physician, because that's more of a marketing thing than a wellness thing. The most I've ever needed to give a patient was 3 times a week, and that patient was in acute pain, so it was largely for the pain management. So yes, there is such a thing as too much chiro, both from the practicality perspective. You never need more than 60 fucking visits. I swear, whatever. Never need more than 60 visits. And then also, too much of anything is going to eventually hurt you, right? So, yeah. Good question. Good question. Any other ones?
Yeah, I mean, like, as like an active person my whole life, I've realized that like my body takes a beating, and I feel like I need this stuff. Does everybody like need chiro? Is there like a perfect person for it?
So again, it depends on the definitions of how you're phrasing that. So I take the word need very literally. We need food, we need shelter, we might need surgery someday. I don't think anybody needs chiro. I don't think anybody needs massage. I don't think anybody even needs physio. You're going to be fine. Can people benefit from what we do? Absolutely. Hands down, no questions asked. To that end, like the archetypical, is that a word, the archetypical? The prototypical? Anyways, the ideal kind of patient for chiro is anybody who, you know, there's such a different range. People such as yourself, people who've taken very good care of themselves, are very, very, or have been very active, you know. Definitely we can help with the stiffnesses, we can help with the process of keeping active, all of that. Then there's the people who have like serious injuries, serious back, chronic inflammatory conditions too, you know. Things like ankylosing spondylitis, yes, I'm saying that correctly. Things like fibromyalgia. There's a whole spectrum of people who can benefit from this. So my urge to anybody watching, and my answer to that question would be to, quite frankly, if you have a diagnosis or you're having symptoms, you can Google those symptoms and ask if chiro works, okay? Obviously, you want to pull from multiple sources, never just accept the one blog post as law. Or you can ask your family physician or a chiropractor themselves. When in doubt, seek professional guidance always. Don't just rely on internet, but again, multiple sources can eventually guide you into the right direction. Does that answer your question?
Yeah.
Okay, sorry. I always go on these tangents. I'm not sure if I actually answered the thing that was asked. Right, more is better. Perfect. Any other questions, or are we finished for that?
I don't think so.
Okay, perfect.
Yeah,
well, Makayla, it was a pleasure having you on.
Thank
you so much for coming in today. And please let me know if there's ever anything else I can do for you, okay?
Thank you very much. I'll be back.
I hope so.
Don't forget to like, comment, share, and subscribe.
Thank you so much, Makayla.